Now let's consider respiratory rate. Remember the special considerations from the start of the lesson? Consider not scoring if the infant has respiratory distress due to transient tachypnea of the newborn or respiratory distress syndrome. Count the infant's respiratory rate for a full minute. The infant should be consoled and or quieted prior to scoring. Score 1 when the respiratory rate is greater than 60 per minute. Score 2 when the respiratory rate is greater than 60 per minute with retractions. The video clip shows chest retractions and the baby is making a grunting sound. This baby's symptoms are from respiratory distress. Excessive sucking consists of swiping the hand across the mouth, rotating more than 3 times before or after a feeding. More than 3 attempts noted a vigorous, disorganized sucking of the hands, fists, or pacifier. Score when the infant moves head side to side while trying to latch on to a pacifier unsuccessfully. Score the infant if any of these behaviors are observed. Poor feeding is the next definition. Do not score premature neonates requiring tube feedings with immature suck, swallow, or breath ability. Score the term infant if the infant demonstrates excessive sucking before and now has an ineffective suck, a poor latch, uncoordinated sucking or gulping, or the need for rest periods during a feeding. Keep the gestational age in mind for feeding. Regurgitation is the return of gastric contents from the infant's mouth. Do not score if associated with a burp. Score the infant if 2 or more episodes of regurgitation is observed that is not a result of a burp. Projectile vomiting is the forceful ejection of gastric contents from the neonate's mouth. Score the infant if projectile vomiting is observed during or immediately after a feeding. Score the infant if stool is more liquid than a normal stool and without a water ring. Take into consideration if the baby is receiving breast milk. These stools are softer, but are not loose and runny. Score the infant if the stool in the diaper is surrounded by a water ring. Water ring on the diaper resembles the color of the more formed or solid stool as opposed to urine. I'm going to play the mother. What? You want to know how my baby is? Okay. Well, she was born 1.5 days ago. What? Well, it was 60 hours. What did it take? Well, I was on the program, for methadone. She ate at 3 o'clock, but it wasn't real easy. She had to stop, and she went to sleep about 25 minutes later. Then she woke up again at 4 and fell asleep again 15 minutes later. Is that normal? What did you say? Yes, well, I guess she is shaking, and I don't know why her bottom is raw.
Can you score it? Well, here are some more details. Brittany's baby is a 38-week female that is 60 hours old, born, as it noted, to a mother with a history of methadone use. The baby fed well at 1500 and was asleep by 1525. The baby woke up at 1600 and was asleep again by 1615. The baby woke up for a feeding at 1750. When awake, the baby had a high-pitched cry despite interventions for 5 minutes. While calm and not being handled, the baby had tremors of the hands and feet. Tremors were noted in the arms with the diaper change. There's a water ring was noticed in the diaper, and the diaper area is excoriated. The baby's respiratory rate is 55 and axillary temperature obtained of 37.1. The skin is dry. The baby had head lag noted when put to sitting. Baby sneezed 4 times while being handled. The baby continually was swiping head side to side, rooting for the hands and the pacifier. The baby with uncoordinated suck while being fed and found to be gulping and requiring rest periods. The baby had 2 occurrences of moderate emesis with burps during feeding. Can you guess the score? Talk to the instructor and find out.